If there are any questions, I will ask the panelists to please go ahead with the questions. And
I have one question on stem cell therapy. So when we've been doing stem cell therapy, we analyzed our 10-year results, and we found, I mean, it's not hard data as yet, but there seems to be a survival advantage for patients who received stem cells. So any comments on that, sir?
Dr. Tulio, you need to unmute yourself.
Oh, sorry about that. In which situation, excuse me, Dr. Gupta?
Yeah. So we use them in two situations. One is acute chronic limb-threatening ischemia, the typically elderly patient. Okay. And this is the group where we found that these patients seem to live longer than the counterparts who've undergone the standard revascularization or who've been on medical management.
Yeah. The patients with chronic limb-threatening ischemia that's a very bad population for us to study because of that. They do not live longer. That's the major issue, because at 1 year, around 60 to 70% they die. So we are unable to follow them up for such a long time. So, but we've been successful in preserving not all the limbs, of course, but some of them, relieving pain. But now our aim is to go for two groups in association with revascularization. I think we will be a little bit more successful, and also for wounds, because we are just using that in ischemic patients, just like you said. That's our problem as well. Okay, thank you for your question.
Thank you.
So, are there any other questions? Dr. Ra, we wanted to just know, I mean, we've got very good cases and procedures you have shown, popliteal occlusion, CTOs, aneurysms, how to treat. When do you suspect a popliteal entrapment syndrome, popliteal artery entrapment syndrome? Because many a times we may just on an angiographic picture just think that it is a normal arterial occlusion, and we may actually not understand that it is a popliteal artery entrapment syndrome. So how do you suspect clinically, and when do you sort of ask them to go for a CT angio or MR?
Yeah, just patients present with the relatively less combination of conventional risk factors for the ASO, and the relatively younger age, and the less background of family history, and this kind of less clinical scenario of less risk of the classical ASO, there looks like a higher chance of the other non-ASO disease. So we have to relook the imaging study. So in the case, before the intervention, I'd like to recommend the careful observation. If the renal function is okay, usually the best option is to at least the CT angiography in the lower extremity, then carefully look at, together with the radiologist, whether there is a presence of any external compression around the pulmonary arterial system. And then before the intervention, we have to look at the location of the relatively relation or location, or the presence of other trouble compressing the pulmonary arterial system by this gastrocnemius muscle or other cystic structure or any other trouble. So that is my usual habit. We have to make a kind of a habit before doing the pulmonary intervention.
And do you also have an experience of using autologous stem cells or commercially available stem cells in your patients?
Stem cell?
Yeah, stem cells for no option patients where we cannot.
Yeah, we have a multidisciplinary approach in our wound center, diabetic foot center with the plastic surgeon. The main plastic surgeon group, actually in the European country, and they have co-worked and studied together for the cell therapy before, maybe more than 10 years. So they have done, I'm not clearly know in detail, but for example, autonomous blood, platelet-derived growth factor, or something, cell therapy they have in the wounded area, autonomous blood cell, and some different kind of cell therapy. However, the most important thing is that despite of cell therapy, that unless any good perfusion is allowed, nothing is so useful. So the plastic surgeon, they realized that the single most important factor is Dr. Ross' performance to give the good perfusion by the endovascular intervention. It's perfect, complete revascularize up to the below ankle. That is the most important than the cell therapy. So now that is the first option. Then, but some really difficult case, they are doing all the multimodal therapy, including hyperbaric oxygen and cell therapy, or the different kind of hybrid management together.
Thank you very much, and I'm really sorry to keep you awake. It must be really midnight in Korea. Thank you again from our side and from the side of Asia Pacific Vascular Society.